So as Julia mentioned, our session today is on demystifying social and behavior change, a key to improving the quality of SBC programming through evaluations. Our goal today is to take some of the guesswork out of social and behavior change, especially for anyone who may be evaluating a nutrition program that uses SBC to improve nutrition outcomes. We know that many nutrition programs use SBC to improve nutrition outcomes. However, when evaluation of nutrition activities are done, we often don't see SBC rise to the surface, resulting in limited or no data on what is and isn't working in nutrition programs as it relates to SBC. When we do see SBC in our nutrition evaluations, we see that they often only evaluate increases in knowledge or shared information, largely communication efforts with very little or no linking along the behavior change pathway from factors to the activities. So there is a real and pressing opportunity to strengthen the evaluation of SBC activities for nutrition. USAID Advancing Nutrition developed 2 guidance documents and a toolkit to support USAID as we're designing calls for evaluations and to support evaluators responding to those calls. Today, we're going to share foundational points addressed in these tools and learn about key considerations for improving the quality of SBC programming through evaluations. Next slide. During this session, we'll start by framing the discussion around SBC in your own lives. And then we'll walk through what we are calling the 5 W's of SBC. Finally, we will give you the opportunity to practice using the information and techniques that we have discussed through an activity. We'll save time at the end for discussion and to answer your questions. So please feel free to drop any questions you have throughout the session in the chat. Next slide. I'm joined today by my colleagues, Veronica Varela, who is who is a MEL advisor at USAID Advancing Nutrition, Riley Auer, who is an SBC project officer at USAID Advancing Nutrition, and Shanika Thurman, who is an SBC advisor at USAID Advancing Nutrition. And I'm Sarah Peterson. I'm a nutrition advisor in the Center for Nutrition in the Bureau for Resilience and Food Security at USAID.
Thanks to everyone for joining us. We have, as Riley mentioned, a huge range of experience with both social and behavior change and also with evaluation. But don't worry, we have a number of activities that will help you learn more about each of those things. So the best way to do that is to really understand what we're talking about through your own life. So before we jump into an activity, I would like to share some key terms that we'll be using in the activity, and then we will explain in more detail soon. So we'll talk a lot about behaviors. We say social and behavior change. When we say that, a behavior is a specific action that a person takes, and that could be at a specific time in their lives. It could be at a specific time during the day, but it's an action that a person takes, and that's the most important thing to remember. So brushing your teeth is a behavior. That's an action that you take at least once a day, hopefully. Eating breakfast could be a behavior. These are all things that we do in our lives. And when we practice those behaviors, we know that they're influenced by factors, things that make it easier or more difficult for us to practice those behaviors. And there are also people who could support us as we are trying to practice. So I want you to remember that key term, behavior, as we go into this first exercise. All right, so we have a challenge for you. So what we would like for you to do is practice a 4-in-1 challenge. So I think you all answered the questions that we have on the slide in one way or the other, but I would love for you to keep thinking about this throughout this presentation. When we talk about social and behavior change, everything that we're talking about starts with a behavior. And all of you had plenty of experience today practicing behaviors, and you noted that there are reasons why it's easy for you to do it and some reasons that it's really difficult for you to do that. So when we start thinking about how we evaluate social and behavior change programs, this is the type of thinking that we have to do in order to figure out what's working and what's not working. Thank you all for participating. This was a lot of fun to see you in the chat and to see you on video. Okay, so I want to go through just a few slides to help or to at least continue to demystify what we say when we're thinking about social and behavior change. What does it actually mean? What are the foundational elements of social and behavior change that we need to remember if we are evaluating a program? But you all have, again, plenty of experience with behaviors. A behavior is a specific action that's performed by a specific person or actor, as we call it, at a specific time or place. And factors, which are also called drivers, are things that make it easier or more difficult for you to actually practice that behavior. So in the example that we just had, a lot of the factors were you were in the right place at the right time. You had access to the things that you needed in order to practice the behavior. Other factors, I saw that there was no childcare, so you needed support in order to practice the behaviors. And it's important to remember that when we are encouraging nutrition behaviors. Speaking of needing support, there are people who can help us practice behaviors if we can't do it on our own. So maybe that means that if there was a childcare provider in the house, that person could support you by taking care of your child so that you could practice the behaviors for 5 minutes. Or perhaps if there was a local vendor in your neighborhood who could make produce available for you during the exercise, you could actually eat the produce, right? So we need all of these things to work together in order to see behavior change. And we like to think of this as a behavioral pathway. All of these things are linked, as you see at the bottom of your screen. So we often start with a big program goal. We want to improve the lives of people in a country. And then maybe we narrow down to a nutrition outcome. We want to see children who are well-nourished, who are not stunted, etc. Then we ask ourselves, if we want to see that nutrition outcome, what behavior should we see? Who needs to do what in order to help us achieve that nutrition outcome? Next, we think about the factors and the supporting actors. If we want to see that behavior change, what factors do we need to consider? Who are the supporting actors that we might engage in order for the behavior to change so that the nutrition outcome does actually happen, and then we reach our program goal? Then we finally get to SBC program activities. This is what we typically think about when we hear of SBC. There maybe is a campaign, there may be some activity that uses care groups or peer groups to bring people together. But when we see those activities, they have to be linked to those factors that are making it difficult or easier for people to practice the behavior, then link back to that behavior, back to the nutrition outcome, and finally to the program goal. So there is a behavioral pathway that we'll talk about a lot during this session. So we often in social and behavior change, when we're thinking about nutrition, have to consider factors. So I offered a few examples of factors on the previous slide and as you were trying to complete your behaviors, but here's a more comprehensive list of factors that we think about in multisectoral nutrition. So let's say we want a caregiver to feed his or her child animal source foods. There may be factors that make it more difficult or easier for that person to do it. Cost may be a factor. I'd love to feed my child animal source foods, but I can't afford it, right? Or maybe distance is an issue. I would really love to feed my child animal source foods, but the only place that actually sells it is kilometers and kilometers and kilometers away. Or perhaps I would love to feed animal source foods to my child, but I don't make the decisions in my household about what we eat. Or I would love to, but I don't quite know how to prepare animal source foods for my child. So there are many, many, many factors that might come into play when we're trying to promote certain behaviors, and we want to make sure that we're considering them as we're evaluating. Okay, I'll pass it to Riley, I think.
Yeah, thanks, Shanika. Okay, so now we have a better understanding of the foundations of SBC, and we can talk about what this means for evaluations. We're going to spend a few minutes exploring the 5 W's of evaluation together. Okay. All right, so why do we monitor social and behavior change? As we know from our personal lives and our excellent opening exercise, behavior change is incremental and can move in various directions, forward and backward and forward again. And then there are all these pivots and adjustments as we go. We need data from multiple time points to pinpoint the full scope of an individual's change in their behavior. So in nutrition programs that use SBC, evaluations help us see our progress, where behavior changes are or aren't taking place so that we can adapt accordingly. Evaluations of SBC and nutrition programs also help to hold us accountable to communities that believe in our ability to improve their lives through behavior change. And then finally, evaluations can help us understand who is benefiting from the program and how they have benefited. So it is it's critically important rather, that we evaluate SBC and nutrition programs. And then a carefully designed and conducted evaluations can help nutrition SBC programmers identify what worked well, can help us identify opportunities to support institutional or project level advocacy for cross-cutting nutrition behaviors, which is particularly important for our audience today. And then nutrition SBC programmers can design and better implement future programs, and donors can use this information to plan future investments and outline their priorities. Okay, so now that we know why we evaluate SBC and nutrition programs, let's talk about what we can evaluate. So as Shanika explained, in SBC, we follow a behavior change pathway. And the icons on the screen represent that pathway. All nutrition programs start with a goal. And from the goal, we may find a few nutrition outcomes. And in this case, we want to increase the consumption of healthy diets in infants and young children. And in order to see that increase, we might ask ourselves who needs to do what to reach a nutrition outcome. That will give you the behavior that we're looking for. So we then outline the factors and activities that address those factors, and we can apply measurement to every part of this behavioral pathway. We use those measures to help us evaluate any part of the behavior change pathway or evaluate the relationship between the elements of the pathway. Okay, so the pathway is a foundational starting point for what we evaluate. But all evaluations also have a set of key evaluation questions that the evaluation team must answer. We've developed 3 resources to help SBC evaluators, USAID staff, and other key stakeholders of SBC evaluations. And so this is a little bit of a highlight of one of those, where we're outlining overarching questions to guide the evaluation and specific illustrative evaluation questions within the resources. So for example, overarching evaluation questions can include, did the activity achieve its intended behavior change outcome? Or to what degree did the activity achieve its intended outcome? Is the SBC activity being implemented as it's originally planned? Or is the SBC activity making any adaptations during implementation? How well are the SBC activities processes working? And how can the SBC processes be improved? Which SBC activity approach is more cost effective? And what were the SBC activity cost and behavior change outcomes before and after the implementation of the activity compared to those with similar activities? What would the cost of scaling up the activity be? And to what extent did the behavior change as a result of the activity? So having SBC specific questions in an evaluation helps us to ensure that the evaluation of the nutrition program doesn't overlook the important role of social and behavior change in improving nutrition outcomes. And as I mentioned, all the resources that we've created also include illustrative questions and other key pieces. These questions and other key points can help and should be adapted to your program. And we'll make sure that we get some practice of that a little bit later. All right, so we've talked about the why, we've talked about the what, and here's the where and how. So both the behavioral pathway and the key evaluation questions help us understand what we might evaluate. And today we're going to talk about 5 types of evaluations relevant to SBC programs and activities. And the first type is this performance or outcome evaluation that you see at the top of my slide here. And these are used to measure activity effects in the focus of the population by assessing progress towards a behavioral outcome or a behavioral outcomes objectives that the program aims to achieve. So from the previous slide, you might remember seeing this key evaluation question. Did the activity achieve its intended behavior change outcome? Or alternatively, to what degree did the activity achieve its intended outcomes? So how could we answer this question and where do we find the data? And we might find them in population-based quantitative surveys or in reviewing records of community groups or community agents. We can do this through community consultations or any of these other example methods that are on the slide here. So our second type of evaluation is going to be the process evaluation. And that's used to understand how an activity, how an activity's behavioral outcomes were achieved. And this type of evaluation can be used to understand the quality of an SBC activities approach by determining how well the processes worked and how they can be improved. And so we can do this through monitoring and evaluation data, and through key informant interviews, among other possible methods. Okay, so 2 more. We've also have the cost effectiveness evaluation, which is used to identify, compare, quantify, and determine the value of economic costs and benefits of an SBC activity. And so it can answer some of those questions that I raised earlier, like which activity approach is more cost effective and what would the cost of scaling up the activity be? And we could do this through demand analysis, risk and sensitivity analysis, cost benefit analysis, or some other methods listed on the slide here. There's also the impact evaluation, which is used to estimate an activity's effectiveness in achieving its ultimate goals. And that type of evaluation includes a counterfactual or a control group to compare outcomes with the group that participated in the activity against those that didn't, the control. And so we can do that using quantitative survey and activity comparisons, MEL data review, reviewing records from community groups and community agents, consultations with communities, and other examples that are here on the slide. And so our final evaluation is the sustainability evaluation. And this one examines either the sustainability of the activities or the level of sustained outcomes. Sustainability of activities is used to describe the likelihood of SBC activities being maintained after the activity ends. And the level of sustained outcomes is used to quantify or otherwise describe the extent to which behavioral outcomes were maintained after an activity ended. And so that can help us answer either, will the activity be continued after external funding has ended, or will the activity outcomes be maintained without activity inputs? And so we can do this, again, using record reviews from community groups, community agents, or consultations with communities, but also observation, qualitative interviews, and participant or population-based quantitative surveys. Okay, and now I'll pass to Veronica for the final W.
Thanks, Riley. So now that Riley has explained what we evaluate and how, let's talk about who should be included in your sample when evaluating SBC nutrition programs. So let's think back to our strenuous exercise behavior from the beginning of the session. How might practicing that behavior have changed if maybe your parents were involved? Or what about if your friends were involved? Or if someone you really like or admire was involved? Go ahead and tell us in the chat how that would have impacted your exercise behavior, whether it would have been a benefit or maybe it would have been harder to implement that behavior. Let us know what your thoughts are in the chat. So as we've seen by many of the answers that we have, not only does the person practicing the behavior matter, but so do their peers and broader social networks. This is an important element to remember when evaluating SBC and nutrition programs. When evaluating behaviors, it's not just the person carrying out a behavior who has an influence on it, but also parents, extended family, possibly other household members, community members. They all play a role in changing a person's behavior, even if they themselves are not practicing the behavior as well. So people who are not practicing a behavior, but have a significant influence over behavior are called supporting actors. So here on the slide, we have a few examples of supporting actors. Some of the examples we have here include health workers who can provide accurate and timely counseling on nutrition behaviors to caregivers. Another example is religious leaders who can shift norms around food taboos for pregnant women. And then we also have policymakers as an example who can develop and enforce policies to increase access to safe, affordable, and diverse foods. So supporting actors are critical to social and behavior change programs, and so they are then critical in evaluating social and behavior change as well. When considering who to include in our evaluation of SBC used in nutrition programs, the decision is not always easy. In a perfect evaluation with no constraints, SBC evaluators would include people from each of the following 4 categories in the respondent groups. So we would have the actor, which is the person practicing the behavior, the influencer, which is a person who inspires or guides the actions of others. The influencer drives the actor's likelihood to perform behaviors effectively. So some examples of this can be respondents, could include other household members, peers, community leaders, or service providers. We would then also have internal stakeholders, so people who are directly responsible for or contributing to a program's implementation activities. Some example respondents for this category, especially for process evaluations, would be the program's SBC team, the MEL team, finance team, senior management, and then USAID staff or staff of whichever organization is funding the program. And then finally, we would have external stakeholders as well. So these are people who are not directly part of a program's implementation activities, but they may have a vested interest in the program's achievements. Respondents could include government or ministry officials, national working groups, or other subject matter experts. Then finally, additionally, when thinking about respondents, it's important to consider the role that gender and power dynamics play as the sample for the evaluation is formed. So when selecting and interacting with respondents, consider the role of gender, and this can help foster critical examination of inequalities and gender roles, as well as promote the relative position of women, girls, and marginalized groups, including transforming underlying social structures, policies, and social norms. As we have seen, there are many different types of respondents that can be included in an evaluation. So here on this slide, we have 2 tiers of possible respondents. Tier 1 is the best case scenario, and then tier 2 is the better scenario when tier 1 is not feasible. So tier 1 is going to include the actor, influencer, and then the observation of the promoted behavior whenever appropriate. If this is not possible, then tier 2 will include the actor and then 1 additional source of data, whether it be an influencer or observation or another existing data source, such as a patient record. We want to include at least 1 additional data source in tier 2, if possible, in order to help triangulate the self-reported data from the actor to ensure data validity and reliability. And so here we have some examples of common prioritized behaviors, and then some examples of tier 1 and tier 2 respondents. So for the behavior of children 6 to 23 months being fed at least 1 animal source food daily, we have caregivers, ASF producers, other household members, and then conducting a market observation as the tier 1 data sources. And for tier 2, we can see that the list of respondents is much smaller. So here we have the caregiver and then another household member being the identified relevant respondents. So going back to the strenuous exercise behavior again from the beginning of the session, put your ideas in the chat of who could be part of our tier 1 respondents and who could be part of our tier 2 respondents if we wanted to do an evaluation on doing that behavior. Yes, so the actor, so you yourself doing the behavior, and then maybe others who were watching or in the home with you. Okay. Yes, so the question is thinking back to the strenuous exercise behavior from the beginning of the session, who could be part of our respondents for evaluating whether that behavior was done or not? Ourselves and the recording of the Zoom if our camera was open, yes, that's a really great idea. That's a great way to use other information that's already existing to see if the behavior was done. Anyone in our house? Yes, household members. Yes, great. So these are all great examples of some tier 1 and tier 2 respondents for that example behavior. All right, and I think I'm going to pass it over now to Sarah.
Thanks, Veronica. Okay, so the timing of SBC evaluations is critical. Different evaluation types require different timelines. So we're going to run through some of the types of evaluations that we've talked about in the session and when we should be undertaking these types of evaluations. So the first, performance or outcome evaluation, this is one of the most common types of the USAID evaluations. And so we should be conducting these either during activity implementation or after or both. A process evaluation, which is investigating if activities were implemented as intended, should be conducted during activity implementation. A cost effectiveness evaluation can be conducted either before, during, or after implementation. An impact evaluation, which allows us to investigate changes caused by the activities, should be conducted during activity implementation. And implementers must plan wisely for this type of evaluation, since you'll need to collect pre and post measurements. Baselines should be conducted before the activities begin, and end lines should be conducted after the activities end. And lastly, sustainability evaluation should be conducted at the end of the activity or after an activity has ended to determine which changes are sustained beyond activity implementation. Ideally, this occurs 2 to 5 years after an activity ends. Planning each of the evaluations that we discussed on the previous slide takes time. And so here, we've mapped out an illustrative timeline for a 5-year program that could use to plan their evaluations. So starting from the left, during year 1, you would determine the scope and design of your evaluation, which means determining which of the evaluations we discussed would be most appropriate for your program. From there, you would build out possible evaluation questions. Doing this in the first year allows you to collect baseline data or plan for monitoring data early in case you need it to answer your evaluation questions later. In the second year, if you plan to do a midterm evaluation, you would work to start finding the perfect evaluation team that has the combination of skills that you need. Early in year 2, or even in year 1, if possible, you would collect your baseline data. And as I mentioned on the previous slide, your baseline data should be collected prior to any program implementation. In year 3 or 4, refine your evaluation questions as needed. If your team opted to conduct a midterm evaluation, you should begin that in year 3 or 4. Once your evaluation is complete, you can use that for adaptive management, and you can also disseminate the findings. If your evaluation team opted for a final evaluation, you can start recruiting your perfect team during year 4. Finally, in year 5, you can refine your evaluation questions as needed if you are doing a final evaluation. You conduct the final evaluation and then disseminate the findings.
So as we mentioned, we've got several different resources that are being used for this session, but then also that are available online right now. All of those are in the chat. And again, we'll share them as an output of this session. The first is Measuring Social and Behavior Change in Nutrition Programs, and that's a guide for evaluators. There's also Evaluating Social and Behavior Change Components of Nutrition Activities, and that's intended to guide USAID staff. And then finally, there's a toolkit, so tools for designing and conducting social and behavior change evaluations. And as I mentioned, all of the guides are available. There are some additional resources from the session, which we added in the chat along the way. And then there are some additional helpful resources just from USAID Advancing Nutrition, again, about this particular work, but we will share more as well. So thanks so much to all for participating today. It's been a great session.